There's going to be a coronavirus update from Scott DiGiralomo and Carlos Perez. Right?
Yep, and Jeff.
Both of you.
You guys will stand next to me, give me support.
And for anyone in the room that doesn't know it, the Morristown Parade has been canceled for Saturday.
This is always difficult for me to stand in one place, but I just wanted to give you a little bit of an update on both what we're seeing across the state and then some of the activities that we've been working on for the last couple weeks. So I gave you your handout. Today we're up to 23 cases in New Jersey. Fortunately, there are none in Morris County yet that are confirmed cases. 29 deaths across the country. One of the things that I wanted to focus on, because I don't know that the messaging from the federal level all the way down has gotten out as effectively as we would like, and I think it's very difficult nowadays with 24-hour news networks and all the social media of some of the things that the feds down all the way down to the locals are trying to accomplish and how that message gets out. So there's certainly a lot of panic and a lot of people that have a lot of anxiety about this virus coming out. Today, the World Health Organization now declared it a pandemic, so that's going to get a lot of media news. Not that it really changes anything that we're doing. But a little bit of perspective of what I just gave you was 23 deaths in New Jersey. 29 deaths across the country, 1 death in New Jersey. If you compare that to the flu every year, there's between 34 and 49 million cases of the flu, and between 20 and 50,000 deaths. What's the difference? So the difference is, number one, is the flu is very widespread, but we know a lot about the flu. So that because of the history, the experts know what the flu is going to do. A lot of people get vaccinated to prevent the flu. A lot of people have immunity from the different viruses because it's been around for so long. When we move into coronavirus and COVID, there is no immunity because it's a new virus. So there are no vaccines, there are no antiviral treatments, and nobody is immune to it. So the same populations that we're concerned about with the flu, that it is so great already, but there's a lot of immunity, so we don't have it. And I always use that analogy, like from the fire department, from a fire prevention bureau or fire marshal's office. It's hard to tell how many fires they prevent because you only know the ones that occur. So with the flu, there's a lot more that are prevented, and this is a novel virus. But I think what's important is to speak about risk, because we talk about that, and that's what really drives a lot of what the response is to this, and risk. And risk is really broken down into 2 parts with this virus. It's the risk of people getting sick, and then the second risk is when people do get sick, how seriously ill are they, or how many people die. So let's go over the bad news first, and then we'll go with the good news. So on the bad news part with the virus is the virus spreads very rapidly. From the history that they have right now, the only thing that they're really basing this on is China, because it's been there the longest, but they're learning more and more as it's getting into other countries and time goes by. But there is sustained community spread with it. We saw that in China. You see that in some of the other countries. I'm sure we'll start seeing it here, where person to person, somebody has to travel, one person gets it, they transmit it to somebody they're close to, and they keep transmitting it down. It's contagious because there's no immunity in the population, and based on that, what the experts are really saying is they expect a large portion of the U.S. population to be exposed to this virus over the next year or 2, based on where the spread is. There's still a lot we don't know. Is it going to be like the flu, in the warm weather it drops down, or is it just going to continue through the summer? So there's a good chance that a lot of people will get sick from the virus. On the positive side, so far from what they saw, again using China, is the vast majority of people that get sick don't get seriously ill or die. So, and I gave you a little bit from the population in China, where they looked at 70,000 confirmed cases in China. 80% of the people that had confirmed cases clinically had mild illness, so very minor, were just home for a few days, and they all recovered. 15 to 20% had serious illness, and in some of the other countries it's actually it's been a little bit better than that. On the positive side, it's a little unique to this disease, is only 2% of those 70,000 were people under 19 years of age. It doesn't really seem to be affecting the younger population. What they're seeing, and Dr. Perez can fill you in a little bit, what they're seeing in some of it is some of the youth that get it aren't even symptomatic. a little bit problematic because you don't know they're sick and they could spread the virus, but they're not having the significant illnesses. The highest risk to people, now I get it, is the older people, except for they draw that line at 60, which is not real far away from where I am, so that I don't think that is old, but at 60, and then it gets more significant over 80, and the highest risk are people who are older and have pre-existing conditions. Diabetes, lung disease, heart disease are significant issues. So one message I think we have to talk about is focus on the risk, and a lot of the response has to be based on what the actual risk is versus just that it's a new virus and it's not going. I think the other messaging that has had people anxious is we saw the CDC and people messaging out about storing food and going out and get things. It's interesting here, it seems to be when the winter storm is coming, everybody goes out and get milk and bread. Now people are going out and getting water and toilet paper. I'm really not sure what the difference is, but they're going out to get it. I think some of the messaging really is, well, why was the CDC recommending getting food supplies and medicine supplies? And unlike in a winter storm or a hurricane where it's that you might not be able, the places might be closed, there might not be power, you might not be able to get to the place. It really was based on two parts. Is one, if a person gets sick, especially if they don't have family or caretakers, they don't want that person that's now sick, that now has to go out and go get medicine or go get food and take the chance of infecting other people. So if you have that stuff there for a week or 2 weeks, the course of the illness will be gone before you really need to go out to get something. And on the other end is, if and when it moves into community spread, that it's out in the community, they don't want, especially the high-risk population, having to go to the store and get exposed to people that may have it. So it's really not a matter of those things, the food supplies won't be available. It's they don't want people moving out and getting into a little higher risk. So what I'll do now is give Dr. Perez a chance to just talk about some of the health aspects in the public health spots. And then I asked Jeff Paul from OEM to just come in and talk a little bit about some of the other things that we've been doing. I think one of the advantages that we have based on how the freeholders now, a number of years ago, when they created the Department of Law and Public Safety, they put both OEM and public health under the same department, so we've been able to easily just coordinate amongst the department to facilitate some assistance to the towns and get some information out. So Carlos?
Good afternoon. I wanted to thank you all for allowing me the opportunity to speak to you and address the board. I want to thank my director and the county administration and the board's continued assistance in our efforts to address COVID-19. As this is a continuing, evolving situation, it's critical that we keep up to date in terms of reliable information. There's a lot of misinformation. So the CDC and NJDOH websites for COVID-19 are the best place to obtain that information, to remain up to date. I wanted to briefly just touch upon the County Office of Health Management's actions relative to preparedness, the actions that we've taken so far, some of our challenges, and the support that we continue to render to the local health officers who serve our 39 municipalities. The public health response in Morris County will and has been vigorous and involved with the principal aim of preventing spread and impact of the virus. But as the situation evolves and continues to evolve, community spread may become evident. And our efforts will greatly be redirected toward more aggressive efforts to contain this disease and to prevent morbidity and mortality. As part of our actions to prevent spread of this contagion, our efforts have been focused on quarantining and isolating persons who are at risk. And I don't want to get too much into the risk categories, but there are some risks associated with recent travel and exposure to persons who may have traveled recently. And based on those risks, we determine what type of quarantine and isolation measures have to be implemented. The staff that's critical to that is our public health nursing and communicable disease staff, both at the county and at local health departments. And they're instrumental in performing these duties. High-risk exposures require daily monitoring and communication with those persons that are confined to their homes. We also have low-risk exposures that may have a voluntary quarantine. So there's a lot of time that is being put into ensuring that there isn't any community spread. As the situation evolves, cancellation of large-scale events may be required. In jurisdictions covered by the county, that covers 7 municipalities, we've already begun looking at canceling some events, only simply as a proactive measure. It's no need for panic, it's just a proactive measure, a measure that is recognized at the early start of anything that may become an epidemic. In this case, as you know, the World Health Organization has classified this as a pandemic. One of our challenges has been testing, and everyone hears about testing. Testing is performed in 3 ways. There is different swabs that are taken and sputum, and there are 2 labs that have been approved to perform testing. That's LabCorp and Quest. And there's about a 3 to 5 day period before we get test results back. And then the local health department also plays a role in that, because we have to approve testing for some patients. They have to meet specific criteria. We don't want to overwhelm the laboratory system with unnecessary tests. We have issues with physicians' offices performing these tests, mostly because they don't have the facilities, the negative pressure rooms, and sometimes they lack the PPE or trained staff to perform any type of diagnostic testing for this disease. We are having some issues with our New Jersey Department of Health Communicable Disease Service, which operates 24 hours a day, which we've been in communication with them. It's just being overwhelmed, I think, by healthcare providers and some of our calls from local health departments. What we're doing in terms of the Office of Local Health, we are having weekly conference calls with our health officers to serve all our municipalities. We're providing guidance 24/7. We've been available at night, anytime that we're needed, to our health officers and communities that we serve, our first responders, our elected officials. We have provided our health officers with risk communication documents in terms of press releases, materials, statements that they may need to put out, and talking points, which we update and we obtain from the state every couple of days. We've set up a shared repository for materials, educational materials that they may use. We've also begun looking at our pods, which is our point of dispensing facilities, the facilities we'll use should a vaccine be developed and we need to administer it to the public. Through grant funding that we receive from the CDC, we get every year, we've appropriated some funds to assist our local health departments with supplies that they may need. For our contract municipalities, it's been quite busy. We've been in communication with our boards of education, our boards of health, our school districts in terms of principals, nurses, and senior facilities. We are also putting out a lot of messaging through our link system. It's a health alert network, which has a very large number of people registered, physicians and other public health partners. And another thing that we're doing as county health officers is public health advocacy. We have spoken to the state health department and we requested the aid on behalf of our locals that is required to address this contagion.
Carlos, can I ask you a question on the amount of time it takes to turn around to determine if a case is positive or not? I thought that was shorter than that.
It depends. If it's a laboratory test, they have to perform a confirmatory test. So that may have to go down to CDC. And so that is resulting
in Atlanta?
In Atlanta. So those are things that need to be worked out. I think once we have more additional testing, we'll have a better idea of community spread. And that's essential that we know how many cases are out there to implement the necessary control measures.
I thought the federal government was working to get more testing to the states so that we could do it locally and not have to wait that amount of time. Is that happening or not?
Yeah, it's happening. It's in the works. That's what we're doing. But
thank you.
I think I just would like to end, if no one has any questions, is that this is a highly preventable disease. And I put some flyers out. These are flyers that we provided to all of our local health departments. It's highly preventable in the sense that it's like the flu in terms of the measures that you can take to protect yourself. It's about hand washing, respiratory etiquette, and staying away. If you're sick, stay home. So that's a message that we want to relay. And most importantly, there's a lot going on in social media. We're monitoring a lot of those posts, and there's a lot of misinformation. So redirecting people to the CDC and NJDOH is critical. Any additional questions?
I've heard the expression presumptive positive. Is that a result of a person that's been tested and the lab results in New Jersey say positive, but it's considered presumptive positive until the CDC?
Until you have a confirmatory test.
Okay, and there's a question as to when do they start the investigation of where a sick individual who has tested positive? Is it when we see the person is presumptive positive or when the CDC confirms it?
The investigation starts right away. So there are people who are identified in terms of travel through the CDC, and that trickles down to the local state health department, then down to the local level. And then the investigations that also come to us through the lab tests that are performed by a hospital, those appear through an electronic system, and it's immediately worked on. It's monitored 24 hours a day by state and local health.
But I was under the impression from an individual who died, might have been as recently as yesterday, gentleman in his 60s. I understood, or what I heard on the news was that research had not been done, no investigation, because they were waiting for a positive. So it just seems that, and I'm not clear if they were waiting for presumptive positive or the final positive test result. But that individual, there hadn't been an investigation done to know where that person's whereabouts had been prior to
I don't know
determination.
the specifics, so I can't speak to that individual case, but I can tell you that once we have a case that may be, even if it's not confirmed, even if it's a low risk, we begin our investigation in terms of contact tracing and where that person has been. It's critical that we have that information. In that case, I can't speak to it. I think that's Bergen County, but it's part of our response plan.
Okay, so we are doing more, we are proactive. Is it consistent from one state to the other, the way that we're doing this and labeling a presumptive positive to a positive? Is that consistent
That's
throughout the
consistent.
country?
Yes, it's consistent because it comes down through our public health service, through the CDC, in terms of how states have to manage this.
Okay, you answered a lot of my questions, thank you.
In regards to travel, so our businesses here, our large businesses here, do we have any coordination with the chamber? Have we talked to the chamber and getting messages out as far as businesses keeping track of their business travel? And
We have a lot of, we operate something called the Fixed Facilities Program. It allows for continuity of operations should there be an outbreak. So we do have a database of large employers, in particular all throughout the county. In the communities that we serve, we certainly are in communication in terms of, they're continually calling us about the employee that may have traveled, the risk, what they should do. So we've been doing it that way. Local health officers will also do that locally with their businesses.
But have we suggested any policy that they implement with the, from us to the local towns to business?
So their
corporate
guidelines,
business, keep track of employees who are traveling out of the country or traveling to the state of Washington.
so the CDC has put out guidance for employers. It's a very, very thorough document that addresses any questions and issues and how to monitor employee health. So that has been provided as much as possible.
Okay, so in regards to, we don't have any cases yet in Morris County.
We are monitoring.
We are monitoring some.
Yeah, but we have no cases.
Scott and I were talking during the week about preparing for any type of, at least with the hospitals, any type of surge in accommodations.
I'll let when Jeff goes up, because Jeff's been the one dealing with the hospitals, he maybe can give you a little overview.
From a
of some of the
capacity
points.
standpoint, I'm saying, well, sure, it won't get there, but if it does, what's the plan?
I left some flyers. Members of the audience are welcome to take that, and if you can spread them around.
Carlos, I have one other question, and maybe too early to know. we know there's a flu season.
Yeah.
Do we know if there's a coronavirus season, or is it too soon to tell whether this will just continue into the warm weather?
Yeah, we don't know, this is it's a new disease. We don't know if there'll be seasonal variations. And with some coronavirus strains, we do see seasonal variations. They seem to be more prominent during colder weather. But we shall see if the spring and summer will
Yeah,
give us a break.
I'm hoping as we go into the warm weather,
I just hope.
the number of cases will
Yeah,
reduce.
absolutely.
Thank you.
Just give a few minutes, because Jeff has been working a lot with the locals on the response end with the hospitals.
So good evening, my name is obviously Jeff Paul, the Director for Emergency Management and also the EMS Coordinator for Morris County. So as Scott mentioned, we have been working with, on the response side, on the operational side, with our local municipalities and responders, and also heavily interacting with the hospitals, all the hospitals, and attending meetings, working with their infectious disease control, and some administrative personnel. And I think, you know, Morris County should be proud that we have a tremendous amount of volunteers that are doing a phenomenal job in local squads, and we have been interacting with many of them as these calls are increasing. So we are seeing an increase in, you know, sick calls and people that have flu-like symptoms. But I think that the importance, and Carlos mentioned it with regards to the antidote, if you will, and the cleansing and cleaning your hands and washing, which is really the key to this whole thing, is the message, and just basic precautionary protection measures. Nothing that's really more significant than having a mask on, gloves, and what we call personal protective equipment. So I think one of the things that the public needs to understand is that, you know, there's a bit of a different response to this issue right at the moment. In the law enforcement side, we've been working with the chiefs of police, we've communicated with all the departments, and for the calls that are sick calls, flu-like symptoms that are not life-threatening emergencies, we have suggested that less introduction of first responders into those environments for obvious reasons. So we don't necessarily need the police officer with equipment that goes into those environments only to potentially run the risk of, you know, exposing the equipment and the officer to that particular spread, you know, airborne particulate kind of spread, when they could triage that call from a telephone, they can speak to the patient, find out what's going on, there's not a life-threatening event, the ambulance is coming, and we can kind of slow the process down, make an assessment. We have worked very closely, particularly with the Morristown Medical Center, and I really do need to give them a shout out because they have worked seamlessly with us, providing us with a tool, in essence, it's a tool that we've shared with all of EMS, a screening tool, which is really the same data that they would need to assess upon arrival in the emergency room at the hospital to find out, so they're better prepared to deal with a particular event. We have done squads, and most recently, I don't want to single out one squad, but I will. In Long Valley, we had a case there with Long Valley's first aid squad that went phenomenally well because of the linkage between police, the squad. We were communicating with them, Scott and I were communicating with them throughout the event, not only around to the call, but at the call, and kind of just make sure that, you know, all the measures were in place, but they were actually phenomenally organized all by themselves with very limited involvement. But what we did do is we were able to conference in, you know, the emergency room, and actually the nurse at the Morristown Medical Center that was actually going to be treating the patient from the scene before the patient even arrived at the hospital. So we kind of slowed it down, controlled it, and let everybody talk, get the history. There was some concern, but it's not a problem as long as we have everybody protected and we're not just arriving at the hospital unannounced and introducing, you know, a patient that potentially can, you know, contaminate others. So all that's controlled. There's a great system in place at the hospitals that we're in partnership with, and I think that's key. The other, in addition to interacting with the first responders, making sure they're prepared, understanding PP, we refer to it as donning and doffing, taking it on, taking it off, is that the public needs to understand that we may be giving them some instructions, or the police or EMS may be giving them some instructions remotely before they're even introduced into the environment. So we ask patients to cover their mouths. They may not have a mask handy at the time of the call, unless they happen to have one in their house, but there's plenty of ways to block your mouth from, you know, visitor. Yes, we talk about a 6-foot standoff distance, but people can put a coat up, a scarf, or whatever, and while we get into that environment, to get them the mask to better protect. Once we do that, it's really business as usual. There are some procedures and some guidelines with regards to EMS workers, and depending on what the intervention is in the ambulance, if there's a, you know, oxygen and bag valve mask and suctioning and intubation, those kind of things that aerosolize issues in the ambulance about how we ventilate and protect the workers in those environments. And more importantly, we're limiting, squads that come out with a lot of people, 4 or 5 people on a crew. You have to ask yourself, and we're telling the squads, look at that crew. Do you actually need to put 4 or 5 people in that environment? The answer is generally no. And do you actually need to put 4 or 5 people into the ambulance to transport one patient to the hospital? The answer is no. So we limit the contact and the exposure. The other thing that we're offering from a county perspective to all of our squads is we are making sure that when they transport a particular patient that might meet the threshold that health's engaged in, and it's gone through the screening process, if it's a higher level case, that we don't want them leaving the hospital in the same ambulance that brought the patient to the hospital, and in essence driving home in a contaminated ambulance. So we are working with them to actually have that ambulance screened and sanitized right there at the hospital. We have Sheriff Gannon, who is here, has actually staff that have been assigned to us and is working in partnership with us on a number of initiatives, but one of which is this one, where we can interface with them. And he's got medically trained people that are also, squad type of individuals that we can interface with these squads and the police and on the medical side to make sure that we're kind of working hand in hand supporting them. The other thing that we're doing, recognizing that PPE is a tough commodity to get right at the moment by all vendors across the board. We're in good shape from a county perspective, is that we are putting a 24/7 vehicle in place that is in position to respond to any municipality and county in support of our volunteers and local responders in the event that it's a high-level case that gets screened by health. The screening pool's been filled out and it can be slowed down. It's not a life-threatening event, it's a sick event, but they might need some assistance either in the process of protecting themselves or maybe need more gear. If we have a nursing home type event or something with multiple patients, we've outfitted our large mobile ambulance bus. We're in the process of changing up the gear, so we're in a position to respond out to the community of Morris to deal with that. But the hospital piece is really, really important, and I think there's some public messaging that needs to happen with regards to patients that feel sick, that they don't just show up at the hospital, because that needs to be controlled. There needs to be a call place. The hospitals have done a good job in speaking to the patient and talking about what might be best, because some patients might just be able to stay right home and don't even need to introduce themselves into a medical facility, only to be screened and then sent back home anyway. They can determine based on the data that's being flowed from the screening tool whether or not additional testing is warranted, and they'll give appropriate instructions. But I think if we can control that process, and I think there's a lot of call fake news or news that's really getting people more worried. I think that if we're doing the elbow bumps, we're doing all that kind of things that limit contact, and wash your hands and protect yourself, and you should be in good shape. And from EMS and police and the responders, we just need to make sure they understand the protection, so we're not putting them at risk. So I think from a county perspective, we are interacting with all of our partners. We're bouncing around every day. We've got more conference calls than I can think about, but we're doing what we need to do. And I think the public should be proud that the freeholders have approved not only the EMS program, which is integral in this piece, but also the resources that we are using to support them and deliver quality services to the public. And thanks to the sheriff for partnering with us on this process. It really is a joint effort amongst many agencies between health and human services and all the divisions that have vulnerable population, the senior citizens, and everyone. So thanks very much. Unless any questions.
So before I open up the questions, just a couple things I just wanted to get across, and because we're talking about what we're doing at the county level, but public health is really done at the local level. So we're doing a lot of partnership and assistance with the local health officers. Carlos happens to be the local health officer by contract to 7 municipalities, so he's holding a dual hat. But for the remaining municipalities, there's a local health officer that's on the ground handling that. I think a little bit of a challenge over time, different from a storm to a health issue, is we stand up for a storm for the blizzard coming, and that's a day or two and we're over. this tempo we can have for months at a time, and you have to be able to sustain that. And on a final note, again, trying not to raise the alarm a lot, we're really looking at this no differently than in February when the meteorologists are predicting the snow bomb, blizzard of the century, and giving you all the models, and we prepare as if it's going to hit. And we know that it may hit, it may go out to the coast, it may go inland, and we might not be as bad as they said. We just want to be prepared in case it does hit. And that's really what we've been doing and what the towns have been doing as well to prepare for that. So not to hold up any longer, we'll open up for any other questions you have.
I also wanted to mention that we've authorized the hiring of an epidemiologist and a part-time nurse to aid our departments and our staff in what they're doing and to protect our residents, because what's most important is the public health and safety of our residents. Anyone have a question? Tom?
Yeah, just getting back to the hospitals, we have St. Clair's with Morris. Right, Morris. So, with children, so what's the capacity if there was a surge?
Which,
I don't want to speak on behalf of the hospital.
Or what's the preparation?
I can tell you that I have been at countless meetings. The hospitals have emergency planning in place. They have what I have determined to be extremely effective programs. They have been researching additional bed space should that become necessary. And as Scott said, it's all about preparedness. So, prepare for the worst and you won't need it. If you don't prepare, you'll need it. So there's a lot of preparation going, probably over preparation, to make sure that we're in a good position. And the hospitals have been nothing but interactive. And I think that they're doing the right thing. And I think you're going to see some, additional announcements on the hospital side of things about what might, be happening in the communities, but it's all very positive from the standpoint that they're ramping up their efforts as well to deal with this issue.
and we do have plans with them, without going into details, that we've exercised before. They're literally the flip of a switch, that we can bring them equipment to assist with some of those plans.
Anyone else?
Yes, I just want to, my wife's a captain of the Long Valley First Aid Squad, and just wanted to pass on to you that they're really appreciative of the communication and support, and very complimentary of how the incident was handled. And from volunteers, getting compliments from volunteers is a big thing. So, and I just want to personally thank you for that, because that is my wife, my daughter, and somebody's wife or daughter or son or husband or relative or friend who's out there. So, and be so not only proud from the county's point of view, but pleased that we are providing all of our first responders with A+ across the board. From training to direction to communication to equipment. And that's the way we should respond. And very proud of that. I want to pass it along and personally thank you.
I appreciate it, and one of the things that I've really focused on or felt was important to us now for the 10 years that I've been in this position is, I always find the responders are always going to respond to help the public. And I saw that in 9/11 when the responders were moving one way and everybody was running the other way. I feel one of the things that our responsibility is to protect the responders that are going to protect other people. So when we hold dual hats and do both, I think that's one of the key elements for this. And I'll end with a personal anecdote. My younger son goes to UDEL, and I think every 5 minutes my wife's been refreshing the UDEL website, and saw today they just announced there's a confirmed case at UDEL, so they're closing the campus. So I'm gonna have to leave early to get the doghouse converted for my son for the next 14 days so he can be outside. So, but yeah, so we're gonna see changes happen. We're gonna see cases come up. I want to say sure, but I'm not gonna be surprised when Morris County gets its first case. It's just gonna be a progression of the disease.
I also want to say I was over at Company One in Roxbury Friday night for the Fish and Chips fundraiser. There was a lot of complimentary things said about the county and the interaction that our local responders are having with the county. So it's appreciated. But also the telephone calls, the conferences we've had, the emails you've received. I really do feel like I'm comfortable in telling people, wash your hands. If you're concerned, step back a few feet. You shouldn't be standing in front of someone who's coughing and sneezing. I appreciate what you have been sharing with us because we're out there too when people are asking us questions. And again, I want to pass on the positive responses, comments that people had made Friday night. Thank you.
I want to thank you all for your presentation and for the hard work you're doing, and recognize that we are having conference calls regularly with our municipalities. We have one scheduled for tonight, and stay safe.
Thank you.
Thank you.
Thank you.
Thank you.